Hi everyone, my name is Marlo John Ribato, grade 12 Bumsto, and I'm going to talk about suicide issue in our country. A suicide is tragedy of a young person dying because of overwhelming hopelessness or frustration is devastating to family, friends and community. Parents, siblings, classmates, coaches and neighbors might be left wondering if they could have done something to prevent that young person from turning to suicide. The reasons behind attempt suicide or attempted suicide can be complex. Although suicide is relatively rare among children, the rate of suicides and suicide attempts increases greatly during adolescence. Suicide rates differ between boys and girls. Girls think about an attempt suicide about twice as often as boys and tend to attempt suicide by overdosing on drugs or cutting themselves. Yet boys die by suicide about 4 times as often girls, perhaps because they tend to use more lethal methods such as firearms, hanging, or jumping from heights. Close to 800,000 people die to suicide every year. For every suicide, there are many more people who attempt suicide every year. Prior suicide attempt is the most important risk factor for suicide in the general population, according to a World Health Organization fact sheet updated August 2017. With World Suicide Prevention Day celebrated this month of September, it is important that suicide awareness campaigns highlight not only the support that is readily available but also tackle most uncomfortable question relating to human behavior. Why do people commit suicide in the first place? It's difficult to understand how a person could not give value to a survival instinct, which is to stay alive from a standpoint of a non-suicidal person. In a 2017 report by WHO, the age standardized suicide rate in the Philippines is 5.8 for male, 1.9 for females, and 3.8 for both sexes. The rate is based from the number of cases affected per sample size of 100,000 people. According to the WHO fact sheet for 2017, suicide is the second leading cause of death among 15 to 29 years old, and 78% of the global suicides occur in low and middle income countries. The most common methods of suicide globally are ingestion of pesticides, hanging, and firearms. Information from the College of Psychiatric and Neurologic Pharmacists in 2016 says that the lifetime risk of suicide for individuals with untreated depression is about 20%, whereas the estimated rate of completed suicide for individuals with borderline personality disorder is 9%. That's all everyone. Thank you for listening.